Good morning and welcome to the retirement information session for optional retirement plan participants with Fidelity and TIAA. My name is Cassie Shorter and I'll be guiding you through today's presentation. Today, we'll walk through the steps for retiring from the University of Arizona, including health insurance options and retiree benefits. We want to ensure that your transition from active employment to retirement is as smooth as possible. We're going to walk through a few key topics today, including first steps to begin your retirement with your department, retiree health insurance options, life insurance, the retiree accumulated sick leave program, vacation payout, what it means to be in official retirement status with the U of A, and the rules around returning to work after retirement. Retirement is a big step, and the first thing you'll need to do is let your department know your plans. You will need to submit a written notification to your department stating your intent to retire. You should do this at least 30 days prior to your last working day. In your notice, make sure it is clear that you are retiring, and you should include your last day of work and your retirement date in your notice. Your last day of work and your retirement date are two separate dates, and it's important to understand the difference. Your last day of work, also known as your separation or termination date, is the final day you are actively employed by the university, while your retirement date is the day you apply for your ORP distribution. We recommend setting your retirement date as the day after you separate. However, you must select a retirement date that is no later than 31 days after your last workday to remain eligible for certain retiree benefits, such as health insurance and the retiree accumulated sick leave. For example, if your last workday is Sunday, May 24th, your retirement date can be Monday, May 25th. This small but important distinction ensures you qualify for the benefits you've earned. Your retirement notification is a significant step in starting the retirement process with the university. You may submit your ORP distribution request electronically to Fidelity or TIAA as early as 4 weeks before your separation. However, your request must be future dated with your retirement date. We cannot approve any distribution requests while you are still actively employed. If you have questions about your retirement account, please contact a representative at Fidelity or TIAA directly. Their contact details are displayed on this slide. Now we're going to transition into healthcare options. As a U of A retiree, you have two health insurance options. The first is with the Arizona Department of Administration, or ADOA. ADOA offers Medicare and non-Medicare medical plans, prescription drug coverage, dental plans, and a vision plan. ADOA administers the benefit plans you have as an active U of A employee, so you may be somewhat familiar with how these plans work. The Arizona State Retirement System, or ASRS, offers Medicare Advantage and non-Medicare medical and dental plans, but does not have a separate vision plan. Instead, vision benefits are included in the medical plan. You are not limited to picking these plans, but they are available to you because you are retiring from an Arizona state agency. We encourage you to do your research and explore all your options so that you select the coverage that fits your needs best. Next, we'll review ADOA and ASRS in more detail. It is important to note that your last day of employment determines when your healthcare coverage ends. Benefits end on the last day of the pay period that includes your separation date. For example, if your last workday is Sunday, May 24th, your coverage will continue through the end of that day, as that is the last day of the pay period. Effective Monday, May 25th, your coverage will no longer be active. ADOA retiree health plans for university retirees begin the next day, Monday, May 25th. Enrolling with ADOA means you won't have any gaps in your health insurance coverage during your transition to retirement. Important to note for employees with domestic partners on their healthcare plans, The state of Arizona does not offer coverage for domestic partners under the ADOA retiree benefit options. Therefore, you will not be able to cover your domestic partner with ADOA in retirement. Contact our office about COBRA options for your domestic partner if needed. To enroll in ADOA benefits, submit your enrollment application directly to ADOA, as the U of A benefits team does not process these forms. We want to ensure your application is handled quickly and correctly. You can find the retiree enrollment form on the ADOA webpage or reach out to our team to obtain it. You may need to submit supporting documentation for dependents that you enroll in the plan, such as marriage certificates for spouses and birth certificates for children. You can upload the enrollment forms to their webpage indicated on the slide, or you can fax or mail it. If you have questions or need assistance, please contact ADOA directly at 800-304-3687. You have 31 days after your last day of work to enroll in ADOA retiree health plans. Retirees must choose either a dental or a medical plan to remain eligible for future ADOA benefits. Vision coverage cannot be purchased as a standalone plan to keep this connection. If you miss this enrollment window, you will unfortunately lose the option to sign up later, and this decision is permanent. The application cannot be submitted any earlier than 1 week prior to your last working day. Do be advised the ADOA may take several weeks to process your application. They are experiencing a delay in processing due to unexpected technical issues with their new benefits system. Our office cannot help speed up this process, so please be patient with them if you enroll in the retiree plans. Again, once they process your application, your coverage will be made retroactive to the day your employee benefits end. Now let's talk about the cost of ADOA medical plans. On the slide, you'll see the monthly premium rates for 2026. If you or your spouse are not yet Medicare eligible, this medical plan will serve as your primary insurance. If you currently have a health savings account plan, keep in mind that you won't be able to continue it as a retiree through ADOA. Instead, you'll need to select the preferred provider organization plan. The good news is that any money left in your HSA can still be used for retirees' out-of-pocket expenses like copays and deductibles. This plan includes prescription drug coverage through MedImpact. The PPO plan has no deductible if you stay in network, so you'll only pay applicable co-payments at the time of service. To keep your costs low and predictable, seek care from in-network providers and facilities. Now, for those who are Medicare eligible, enrolling in an ADOA retiree medical plan requires that you sign up for both Medicare Parts A and B. Medicare will be your primary insurance coverage and payer, paying for 80% of covered medical expenses, while ADOA's plan will serve as a secondary payer, taking care of the remaining 20%. If you have Medicare and are electing the medical plan through ADOA, this plan comes with prescription drug coverage through Vibrant Rx, which is the Medicare Part D prescription drug plan. You must complete and submit the Vibrant Rx enrollment forms to ADOA along with a copy of your Medicare card or entitlement letter. MedImpact is the prescription drug provider for the non-Medicare medical plans, and it's included in your medical coverage. Vibrant Rx is the prescription drug plan for Medicare-eligible retirees and their Medicare-eligible dependents. If you choose any ADOA medical plan, you'll pay a combined medical and pharmacy premium and automatically enroll in ADOA's prescription drug plan with Vibrant Rx. They use a 4-tier formulary system with the copay shown on the slide. You'll present your Vibrant Rx ID card at the pharmacy when filling a prescription. You can only be in one Medicare prescription drug plan at a time. So, if you are enrolling in a separate Part D plan or a Medicare Advantage plan after selecting coverage with ADOA, you will be disenrolled from the ADOA medical and prescription drug plan. Now let's talk about dental coverage. This slide shows the 2026 monthly ADOA dental premiums. As a retiree, you have the option to enroll in a dental plan through ADOA. These are the same United Healthcare Solstice HMO and Delta Dental PPO plans offered to active employees, and you can elect coverage for yourself and any eligible dependents. If you do not enroll in an ADOA medical plan as a new retiree, but do choose an ADOA dental plan, keeping your dental coverage allows you to maintain eligibility to enroll in medical and/or vision at a later time. This could be during an open enrollment period or if you experience a qualified life event. In other words, enrolling in at least an ADOA dental plan keeps you eligible for other ADOA benefits down the road. If you do not enroll within 31 days after your separation, you will not be able to enroll in the future. This slide shows the 2026 ADOA Avisus Vision premiums. One key difference with vision coverage is that Avisus bills annually instead of monthly, like medical and dental. If you enroll in the middle of the year, your costs will be prorated based on when your coverage begins. It's also important to know that vision is not a standalone benefit with ADOA retiree plans. To keep your vision coverage, you must also be enrolled in either an ADOA medical or dental plan. The ADOA retiree benefit plans work similarly to your U of A health plans when it comes to networks, deductibles, and copays. ADOA holds open enrollment once a year, usually in October or November, which aligns with the U of A's open enrollment period. During open enrollment, you can make changes to your current coverage or enroll in a medical and/or vision plan if you previously elected dental coverage only. It's important to keep an eye out for notifications from ADOA about open enrollment that come through email or mail. Now we're going to switch gears and discuss the plans that the Arizona State Retirement System, or ASRS, offers. They have medical and dental benefits for retirees and their qualified dependents. ASRS plans also include prescription drug coverage. Just like ADOA, you have 31 calendar days to enroll in ASRS health plans after your separation. To sign up for ASRS medical or dental plans, you'll need to contact ASRS directly and request enrollment forms. You cannot be enrolled in both ADOA and ASRS medical or dental plans at the same time. However, you can mix and match by selecting different plans from each system. For example, you might choose the ASRS Medicare Advantage medical plan, but keep your United Healthcare Solstice dental plan through ADOA. For details on the available medical and dental plans, visit the ASRS website indicated on the slide. A key difference between ASRS and ADOA is the effective date of coverage. Unlike ADOA, where the benefit effective date coincides with the U of A, coverage with ASRS is effective on the first day of the month following the end of your existing employee healthcare plans and the submission of your enrollment forms for their plans. For those employees thinking they may enroll in the ASRS health plans, consider ending your employment near the end of the month so you avoid a longer lapse in coverage from when your U of A insurance ends and when your ASRS plans begin. ASRS offers United Healthcare Medicare Advantage HMO and PPO plans for retirees who are Medicare eligible. The Medicare Advantage HMO plan is the more affordable option, but only provides in-network coverage through UHC within Arizona. If you seek care from an out-of-network provider, these services will not be covered. With the HMO option, each covered individual must choose a primary care provider from the UHC's network of providers. The Medicare Advantage PPO plan costs more per month, but gives you both in-network and out-of-network coverage nationwide. Both plans include a Medicare Part D prescription drug benefit, meaning that when you enroll in either plan, prescription coverage is automatically included. ASRS will bill you directly for your insurance premiums. The rates reflected on this slide are for retirees who are not yet eligible for Medicare. You have 3 different plan options to choose from: Choice Premier, Choice Value, and Choice Economy. With these plans, you must receive care from a contracted in-network provider. There is no out-of-network coverage. These 3 plans offer virtual visits from anywhere, a nationwide network of doctors and hospitals, pharmacy benefits. It's important to review each plan to see which one best fits your needs, especially if you travel frequently or have specific provider preferences. You can visit the ASR website for more information and to compare the 3 options, as deductibles and copays for covered services will vary based on the plan you select. ASRS offers HMO and PPO combination family plans designed for retirees with both Medicare and non-Medicare eligible dependents. The Group Medicare Advantage HMO combination plans are only available to Arizona residents and provide in-network coverage within the state. The Group Medicare Advantage PPO combination plans are available nationwide and offer both in-network and out-of-network coverage. For more details on coverage, premium rates, and provider networks, please refer to the ASRS website. ASRS also offers dental coverage through Delta Dental PPO and Cigna Dental HMO. The rates and coverage details are shown on the slide. With Delta Dental, you can choose either a high plan or low plan option. The low plan option does not cover certain major services, though, such as implants, dentures, crowns, or orthodontia. However, either plan gives you flexibility to see both in-network and out-of-network providers. Do note that your out-of-pocket costs will be higher if you choose to go out-of-network. This plan is offered nationwide. Delta Dental also includes a vision discount program that gives members access to reduced rates on services like eye exams, frames, and contact lenses. The Cigna Dental HMO plan does not have a deductible or annual benefit maximum. Instead, you pay a fixed portion of the cost per visit. You must choose an in-network provider to coordinate your care, and you will not have coverage if you visit an out-of-network provider. This plan is not available in all states, so please visit asrs.gov to learn more. Retirees and their eligible dependents may also choose to elect COBRA. COBRA is administered by the Arizona Department of Administration and allows you to continue the coverage you had as an employee. COBRA may continue coverage for 18, 29, or 36 months depending on the nature of the qualifying event. All employees who separate from employment will automatically receive a COBRA packet in the mail after their coverage ends. It can take up to 14 business days for this to be mailed out. You or your dependents have 60 days to enroll in COBRA after your loss of coverage. Coverage will be retroactive to your benefits end date once your enrollment is processed. If you are enrolled in a healthcare FSA, you can continue that coverage through COBRA through ASI Flex. But dependent care FSAs cannot be continued. If you do not continue, you can only be reimbursed for expenses incurred before your benefits ended. Now that we've covered your benefit options, let's shift to Social Security and Medicare. Everyone is required to sign up for Medicare Part A and B at age 65, unless they have a qualifying coverage through their employer or their spouse's employer. In that case, enrollment can be delayed without penalty. If you have delayed your Medicare enrollment beyond the age of 65 due to your medical coverage through your position at the U of A, you can reach out to our office for proof of coverage that you'll provide when enrolling in Medicare. If you need to enroll in Medicare, you should start this process 30 to 60 days before your planned Medicare start date to allow adequate processing time. The Social Security Administration provides personalized information and guidance on your Social Security and Medicare benefits. Our office cannot consult to you on these benefits. If you would like additional support as you prepare for retirement, you may also consider community resources such as the Pima Council on Aging, a local nonprofit organization. They offer services like benefits counseling and Medicare guidance. They can be a helpful resource for more personalized one-on-one support. Another resource we recommend is SGIA Medicare Consulting. They are a free resource for retirees exploring Medicare options. They can provide guidance on available plans and help you determine the best fit for your needs. If you have questions about Medicare enrollment or coverage, SGIA can be a valuable resource. You may have the option to retain your group life insurance coverage that was in effect at the time of your separation. If you're interested in continuing your coverage, you will need to explore your portability and conversion options. Portability allows you to continue your current coverage at group rates, while conversion provides the option to switch to an individual policy. For details on how to proceed, contact your provider. The Hartford and/or Unum for assistance with your options and next steps. You have 31 days after you separate to start the process, or else you will lose the opportunity to continue your coverage. The Retiree Accumulated Sick Leave Program provides eligible retirees with a payout for a portion of their accrued but unused sick leave. To receive the RASL benefit, you must meet the eligibility criteria. Be an active Arizona state employee at the time of retirement. Request your distribution from your ORP no later than 31 calendar days after your separation date. Have 500 or more hours of accrued unused sick leave at the time of retirement. Apply for the RASL benefit within 150 days of your retirement date by completing the RASL certification form and submitting it to the U of A benefits team. Final eligibility is determined by the ADOA General Accounting Office. To apply for the RASL program, you must complete and submit the RASL packet, which includes the RASL application, state and federal tax forms, and an optional deferral form for nationwide. All forms must be sent to our U of A benefits team for processing. If you intend to defer your first RASL payment to a nationwide 457B account, you must create your account with them prior to your last day of employment. There is a strict deadline to submit your RASL packet to Human Resources for processing. Our office must receive your application no later than 150 days after you've separated from the university, so that we have time to process it and get it to the GAO by their deadline of 180 days. However, we do strongly encourage you to submit your RASL packet prior to your retirement date to ensure you do not miss the deadline. There is no appeal process with the GAO if you fail to submit your documentation on time. Timely completion and submission of the forms is the responsibility of the employee. Your RASL benefit will be paid out in 3 equal annual installments. The amount you receive is calculated by multiplying your hourly rate of pay at the time of separation by the number of unused sick leave hours multiplied by the applicable percentage. Keep in mind that any hours over 1,500 will be forfeited. Our office cannot process your RASL payment until we can confirm both your retirement from Fidelity or TIAA, your final paycheck has been processed and you access. The specific RASL percentages are shown on this slide. Example calculation. If a retiree has 1,500 sick leave hours and a final hourly rate of $20 per hour, their total RASL benefit will be 1,500 hours times $20 times 50%, which equals $15,000. A few things to keep in mind. The RASL benefit is subject to taxes, including Social Security, Medicare, federal, and state tax withholdings. The maximum total RASL benefit you can receive is $30,000 before your withholdings. The RASL checklist shown on this slide is a helpful tool to ensure you complete all necessary steps in the application process. You can find this checklist and necessary forms on the Arizona General Accounting Office website. If you have any questions about the RASL application process, feel free to reach out to your U of A retirement team for guidance. It's important to submit a complete and accurate RASL packet. If we receive your documentation and notice any discrepancies or missing information, we will reach out to you since incomplete packets cannot be sent to the GAO. Accrued vacation for appointed personnel, classified staff, and university staff is paid upon separation and retirement, up to the amount earned in 1 year of service. This payment will be made in your final paycheck from the University of Arizona. No action is required by the employee for this payout. If you are eligible, U of A payroll will issue this payout in your final paycheck. The university provides certain privileges to retirees who qualify for official U of A retirement status. To be eligible, you must meet all of the following requirements. Be at least 50 years old, request a retirement distribution from TIAA or Fidelity no later than 31 calendar days after your separation date, have completed 5 years of continuous benefits eligible employment in the Arizona University system immediately before retirement, not have been terminated for cause by the university. If you meet these requirements, you will be recognized as an official U of A retiree. As an official U of A retiree, you can continue using the Qualified Tuition Reduction Program just as you did while you were employed. The same terms and fees apply, and your eligible dependents can still use the benefit too. You are also eligible to apply for a free retiree parking permit. If you want more details on where you can park and how to apply, reach out to the U of A Parking and Transportation. Your U of A email address can remain active if you choose, so you don't have to worry about losing your at arizona.edu email account. U of A Libraries also allows retired faculty and staff access to the library during public and CAT card only hours to reserve rooms, request or place holds on materials, and more. You can contact U of A Libraries to learn more about the privileges they grant to retirees. Retirees can obtain a membership to the Campus Recreation Center. They have a variety of membership options, so please contact them if you have a question or would like a membership. Lastly, be sure to hold on to your CAT card because it gives you access to discounts at the U of A bookstore, athletic events, and U of A Presents when available. If you'd like to keep your at arizona.edu email address after retirement, you'll need to opt in within 60 days of your separation. If you don't opt in, your email account will be automatically deactivated. If you need help with the opt-in process, UITS is available to assist. Our final topic today is about returning to work after retirement under the optional retirement plan. If you or your department is interested in having you return to work after retirement, there are important rules you need to be aware of. Under ORP and Internal Revenue Service regulations, you and any Arizona University System employer are not allowed to prearrange your return to work before your retirement date. This means that there cannot be any agreement, formal or informal, about returning to a position before you officially retire. Additionally, if you return to work after retirement, you cannot start any new distributions from your ORP while you are employed, even if you hold a non-retirement and non-benefits eligible position. In-service distributions are not allowed, so any distributions must have been set up at the time of retirement. If you would like additional support as you plan for retirement, our team is here to help. Our benefits team provides guidance on the university's retirement processes and benefits. Employees may schedule a one-time retirement appointment to focus on individual questions and next steps. We recommend scheduling your appointment about 3 to 6 months before your planned retirement date. Availability can fill up quickly, so planning ahead will help ensure we can support you at the right time. That wraps up the U of A retirement presentation. If you have any questions, please make sure to reach out to our team. You can email us at hrsolutions@arizona.edu. Thank you so much for joining.